Good afternoon. You're tuning into the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macy Smith. Today's show is sponsored by MUSC Health Orangeburg. Joining us today from MUSC Health Orangeburg is Dr. Catherine Millender. Dr. Millender is an intensivist. Did I say that correctly?
You did. You did a great job.
Thank you so much. Thank you for joining us today.
Absolutely. Happy to be here.
Thank you. So I got to start with, what in the world is an intensivist?
An intensivist is an ICU doctor.
Okay.
So to become an intensivist, it's a critical care doctor. And for me, I started out in internal medicine, and then I went on to do a specialty in pulmonary medicine, and then critical care medicine from that. So then I started out working as an ICU doctor.
So why critical care?
I love it. When I was going through medical school, I really enjoyed medicine, and I also really enjoyed little aspects of surgery and emergency medicine. And so critical care was the happy union of all of those.
Yeah. So now you know that. Well, I'm sure you know this better than anybody else. So the counties that you all serve, Bamberg, Calhoun, Orangeburg counties, very rural. The data supports that, individuals living in the counties, and I'm from the county too, high rates of high blood pressure, high cholesterol, diabetes, obesity, a lot of chronic illnesses that could, lead to an ICU visit. What have you been seeing in the Orangeburg ICU? Have you seen an uptick over the years of people coming in just for what I would say are possible preventable conditions?
Absolutely. So yes, you're right. We absolutely have a lot of chronic medical conditions here in these counties. We do serve 4 counties. And
so that's Bamberg, Calhoun, Orangeburg,
Calhoun, Bamberg, and Barnwell.
Okay.
And so we do see a lot of preventable problems that come in. So a lot of the times we'll see things with very high blood pressure that leads to complications like heart attacks, strokes. We also see diabetes and their complications such as peripheral vascular disease, dialysis, end-stage renal disease, things like that. So we do see these very prevalent here in this hospital.
Have you seen where education, if education is introduced early enough, or if education is presented in a manner, when we talk about health literacy in the community and in general in the U.S., the average American reads on the 6th or 7th grade level. Have you been able to provide educational materials to individuals, and have you seen that as a possible, reduction?
So I'm a huge advocate for education, especially out in the community. In my job, because I tend to be the last line for patients, we do absolutely provide education for these patients about how to treat their disease so they don't come back to the hospital, and certainly not the ICU. Education has been shown to be very beneficial. Usually if it's done on the community level, say in primary care physician offices, or even through social media, absolutely that education is very important.
Do you have, and I'm probably just making this up in my head because, the last place anybody wants to end up is in the ICU. I know when we hear it in the community where I'm from, North South Carolina, shout out to North South Carolina, oh, Miss Janie in the ICU, we think it's going to be the end. Now, is that always the case, or is that the happy medium between the two? What would your response to that be?
I will agree. No one ever wants to find themselves in the intensive care unit. As a patient, certainly no. We definitely have patients that come into the ICU that then subsequently get better and able to discharge. So not everything in the ICU is considered end-of-life care.
Okay, perfect. So we're going to take a break. Absolutely. When we come back, because you are a pulmonologist, and you talk and you treat, you talk about and treat respiratory illnesses, I got to talk to you about, COVID, pneumonia, the flu, all the things, so that way we can better understand what's going on with those respiratory illnesses and ways that we can prevent it. We'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. We're still here chatting with Dr. Catherine Millender, intensivist, aka ICU doctor with MUSC Health Orangeburg. Now, Dr. Millender, before we went to break, I wanted to talk with you about COVID, pneumonia, and RSV. That's what we're seeing now in terms of I'll say is it upper respiratory illnesses, or is it just respiratory illnesses in general?
Just respiratory illnesses in general, and we do have to throw influenza in there as well.
Right. So before you would see either flu, then you might see flu and a little RSV, but now we're seeing COVID mixed with flu, mixed with RSV. I know over the Christmas holidays, almost everybody who I spoke with, they were sick. They either had COVID, RSV, flu, or something that they just couldn't figure out. What's going on now with 3 of those areas?
Sure. So we see a huge rise in these respiratory viruses in the wintertime anyway. That's their season that they tend to thrive. And you're right, we have seen a large uptick, especially following Thanksgiving into the Christmas holidays and now into January, of these respiratory viruses. We do know that COVID, the strain that's going around right now, is the JN1.
So it's different strains of COVID.
There are multiple different strains.
Like the original COVID had a baby, and then they had a baby, and then that one had a baby. Okay.
Yes. But the good news about the COVID strain that's going around right now is that it is protected. You can reduce your risk by getting the COVID vaccine.
Right. I was going to ask you about vaccinations. So you do recommend that people get COVID vaccines, flu vaccines. Now, is there an RSV vaccine?
There is. There is a new RSV vaccine for adults who are 60 years and older.
Okay.
And then also women who are in their 3rd trimester can get it to protect the baby as well.
Now, if someone becomes ill with COVID or RSV, is that something that they could treat at home?
So some of the times, or most of the time now, it can be treated at home.
Oh, wow.
So a lot of the times you can do just symptomatic treatment. So things like Tylenol or Motrin, which is ibuprofen, to help reduce fevers, make you not feel so yucky, and just treat at home. Now, if you start to feel as though you're very short of breath, you're not able to catch your breath, your fever is staying up, that's when you need to go see your primary care doctor.
Okay, I was going to ask you that too. And it's always best to go to the primary care doctor as opposed to the ER, right?
Absolutely. So we reserve the emergency room for just that, for emergencies. If it's something that can be treated symptomatically by your primary care doctor, we always encourage you to go there first. A lot of the times for people who are in the ER, we can get, patients can end up getting sick with something else.
Oh, when they come to the ER, yeah.
Exactly. Or worse yet, they end up waiting for hours because so many people have elected to come to the emergency room rather than go to their primary care doctor.
I'm glad you mentioned that, Dr. Millender, because, you know, people love to say, and I'm not saying that they're not telling the truth, but they talk about how long the wait is at the hospital, the ER, not just MUSC Health Orangeburg, but that's across the board. But speaking about MUSC Health Orangeburg, when they talk about the wait, I oftentimes have to remind people, I mean, this is not an excuse for the wait to be there, but this is the reality. Many people use the ER or the ED as a primary care practice.
Yes, and that is really not truly primary care or preventative medicine. So the goal for all of medicine is to help prevent illnesses, and things happen, like getting a cold, getting the flu, absolutely. But if you're waiting for a long time in the emergency room, chances are there's patients who are sicker, who have to be triaged sooner. There's more life-threatening illnesses.
Okay.
And you're much more likely to get a same-day appointment with your primary care doctor and be seen sooner or in a more comfortable setting.
That's a great
than
point.
coming to the emergency room.
Yeah. Before we go to break, I have to ask you a question.
Of course.
My mama would always tell me, and my grandmama would always tell me, I used to have to put on that little ugly sweater hat with the ball on the top, because they said if I go out without something on my head and, you know, my body, I was going to catch a cold. Can you catch a cold from being cold?
You cannot catch a cold from being cold, though it is very unpleasant. And as someone who was born and raised in the South, I prefer not to get cold. But no, you cannot catch a cold just from being cold.
Well, thank you for saying that, Dr. Millender. It didn't come from me. It came from Dr. Millender. We're going to take a break. We'll be right back. It's the People Station. Thank you so much for sticking out with us for the Health and Wellness Hour. We're still chatting with Dr. Millender. She is an ICU doctor, aka intensivist. So, Dr. Millender, you're very smart. I mean, I can't wait to tell my mama all about the fact that you can't catch a cold when you're cold. But now you have won an award recently, because I know all that intelligence doesn't just like sit there. Tell us about the award you just won.
So thank you for mentioning that. I did win a HighQuity We See You award.
Oh, I like that. We see you.
Yes. And so it is awarded, it's a nationwide award for anybody who works in the ICU collaboratively with our tele-intensive care team. So we do utilize a tele-ICU team in the ICU for the time when I'm not there.
So that's telemedicine.
Telemedicine,
correct?
exactly.
So are you seeing an uptick in people using telemedicine? Is that something that you encourage?
Well, we do utilize that here in the hospital for 24-hour ICU coverage. I'm the only intensivist for these 4 counties, and so I do like to go home and try to spend time with my family.
That's right.
And so I can't be here all the time. So when I'm gone, we do use that tele-ICU service. We have seen a huge uptick across all fields of medicine for teleservices, especially during the COVID pandemic, and those services have continued.
And that has been a blessing. Now, how long have you been here at MUSC Health Orangeburg?
I've been here in Orangeburg for 4.5 years.
Wow. So you serve a great purpose for our community. I'm just seeing you smiling, and I feel like you love what you do. You are truly a blessing for our folks in our community, because, for you to invest your time and your talent with us is very, very meaningful. What advice would you give to our community, my community, your community now too, to prevent those, or to reduce the risk of those respiratory illnesses that could land someone in the ICU?
Absolutely. So like you said, preventative health care is something that is very important. So one of the main things that we can do as a community is, again, educate yourselves about these viral illnesses. We encourage you to go get vaccinated. That's your flu vaccine, your COVID vaccine, and then for anyone over the age of 60, we can also do your RSV vaccine, your pneumonia vaccine, there's shingles vaccine. So I'm a huge proponent for vaccines. I get them, my mom gets them, my family gets them. I encourage it. We also want to make sure that you're being healthy and getting your checkups every year, and making sure that you're keeping all of your other chronic medical conditions like high blood pressure and diabetes under good control.
Thank you. I always love to leave our listeners with basic, tangible tips and strategies that they can put into practice today to encourage, healthy lifestyle and healthy living. Thank you so much for being here. I look forward to chatting with you sometime in the very near future.
Sounds wonderful. Thank you.
And thank you all for tuning in to the Health and Wellness Hour. The show today is brought to you by MUSC Health Orangeburg. Until next time, it's the People Station.